Good afternoon and welcome to the CHO 8 launch of the Patients Deserve Better campaign for community neurorehabilitation teams. My name is Mags Rogers. I'm the Executive Director with the Neurological Alliance of Ireland, which is the national umbrella for over 30 neurological organisations around the country. Our Patients Deserve Better campaign is calling for a network of 9 neurorehabilitation teams, one in each of the 9 CHO community health organisation areas. CHO 8, which covers counties Laois, Offaly, Meath, Louth, Longford and Westmeath, currently lacks a dedicated community neurorehabilitation team. And we'll hear this afternoon from our speakers about what impact this continues to have on people living with neurological conditions throughout the counties in CHO 8. Before I introduce our speakers this afternoon, I want to outline very briefly what a neurorehabilitation team is. Basically, it's where all of the essential therapies come together. Services such as physiotherapy, speech and language therapy, social work, neuropsychology, and occupational therapy. And they work together in a multidisciplinary way to provide vital care to people with a range of neurological conditions living in the community. Where these teams are up and running, and bearing in mind there is no team in CHO 8, the teams are up and running in Limerick and Donegal. They provide an essential service, not only to provide people with access to those vital therapies, but also to link people to other services, including the vital work provided by the neurological charities. And I'm delighted to have so many of our neurological charities involved in this campaign. And you can see them there that are present on the call today. I'd also like to welcome any of our elected representatives from CHO 8 to this afternoon's webinar. I'd encourage them to introduce themselves via the chat or Q&A and let us know that they're here, and we really appreciate it. Really appreciate their support. If you have a question or comment, please use the chat or Q&A function, and I'll bring it to the attention of one of the speakers. As I say, we have a number of speakers this morning. We have 2 lived experience representatives living with neurological conditions in CHO 8. And just before I move on to them, I just want to introduce our first speaker, Dr. Karen O'Connell, who's a consultant neurologist, but also a specialist in neurorehabilitation. Dr. O'Connell, if I can ask you to introduce yourself and speak.
So I apologise that I was a little late joining everyone this morning. I just got stuck in a clinic, as always happens when you want things to go smoothly. And apologies if someone walks in. So my name's Karen O'Connell, and I'm very delighted to be involved with this today. I think the reason that I've gotten involved and are joining the speaker is just around, I suppose, the second half of my job. So I work half-time in Tallaght as a neurologist, and I guess over many years of seeing many patients with different types of neurological conditions, have seen really the gap in service from a community rehabilitation point of view. And over the last 2 years, then I've had the opportunity to be linked in more directly with a rehabilitation service or a neurorehabilitation service through Peamount Hospital. And so we are part of the managed clinical network in rehabilitation. And we were kind of launched as, I suppose, a kind of a tester site or a demonstrator site, offering kind of acute level 2 inpatient neurorehabilitation care. So I suppose, what does that mean? And I think, is this part of, Mags, what you were kind of keen for us to have a little bit of a feel for today? Is that, am I on the right track?
You are absolutely, Dr. O'Connell, and just, I suppose, the impact of the importance of a community neurorehabilitation team and what impact that makes on people living with neurological conditions in the community, from your perspective of being able to discharge out to the care of a team like that.
Yeah, so I suppose that's why I was just going to begin. So just to paint the picture of what can be offered, and then to maybe bring in where I think the community will help. So when we have 15 beds now, and that allows us to admit people acutely from the acute services for rehabilitation, following things like stroke, traumatic brain injury, neuroinflammatory conditions. We've also tried to protect a short number of beds, and with time to grow this around maybe offering more dedicated inpatient rehab to people with chronic neurological conditions. So what we see with conditions like MS, the more long-term sequelae of traumatic brain injury, Parkinson's disease, and those kind of conditions. And what we've seen really is the demand for that level of rehab has been huge, and our turnover of beds has kind of slowed down. And this is where we really are hopeful that the community neurorehabilitation team will be able to come in and able to increase the offering then to people, particularly within CHO 8. So what I would see the community team offering us is an earlier access and earlier discharge from the acute hospital or from the level 2 rehab hospital, allowing people to get home to have a more maybe protracted kind of period of rehabilitation in their own environment. And I think that's often actually the time when a lot of the needs are identified. And a lot of the areas that can be worked on in terms of getting people back to their kind of more daily functioning. I think the other area where I would see it, and that's from my other hat, maybe working more directly as a neurologist, is around people who have, long-term conditions, have been doing reasonably well, but maybe for different reasons, a recent illness or otherwise, things have taken a significant step back and they've lost a level that they had before, and just need that level of kind of maybe specialism from a team who have a good understanding of the kind of neurological needs, been able to get someone back to a former baseline. Or in terms of maybe more focused work around, so often our needs around, say, employment, things like that, we need to have a kind of more focused look at that. And again, I think that's where the community neurorehabilitation team be very helpful in identifying maybe a clear goal, and working with someone over a number of weeks trying to reach that and deliver that. And then I think where there needs to be kind of great partnership, and certainly from our side as the inpatient level, is around the other supports in the community. And I think that's where the NAI supporting this program, but also bringing together all these organizations, is very important, because blocks of rehab are excellent, and you can certainly focus on a goal and achieve a goal, but then the more kind of bigger picture look in terms of sustaining these goals and the more longer term focus, I think it's important. And that's where a lot of the community support organizations have been really, really helpful for people. And I suppose also family members, and that maybe is something that we're not as, maybe as focused on in what we do. And so they're the kind of areas that I certainly would see as been serviced by the CNRT, and it's certainly a gap that I would feel is there at the moment. And I think, what distinguishes it is having that specialism and that understanding of neurological conditions that I think is sometimes absent. I wouldn't say universally at all, but just sometimes absent maybe from the more general community teams, and I think that patients really appreciate, or service users really appreciate, when they're talking to someone who has some level of understanding of what their condition is, what their needs are, how to approach it. And that would be, I think, something that I'm sure a community team would really strive to deliver.
And Dr. O'Connell, can I just ask you, you just spoke earlier about the turnover. So getting people out from the hospital bed to the community. Is that something that you're seeing, that you literally can't have the turnover you need? You can't get people discharged from the neurorehabilitation services because there aren't the services in the community to accept them?
Yeah, so we would certainly see that. So we did a project, and it was about 18 months ago, where we looked at our discharges. And at that point in time, 50% of the people who were in under us could have been discharged if they had access to a CNRT at that snapshot in time. So it certainly, we've kind of estimated that we could shorten the inpatient length of stay by anything by 2 to 4 weeks for kind of acute conditions. And there are obviously exceptions, people who've had maybe a more significant life-altering brain injury, will often spend many, many months in an acute hospital or in a rehabilitation hospital because those step-down services aren't available. The other place, I guess, maybe to give an example of where this kind of service has worked or has been helpful and improved throughput, is around what we've seen with stroke services. So the stroke service, or the early supported discharge part of the stroke service, has really been very effective in facilitating either discharge directly from an acute hospital with a view to an inpatient admission, facilitating discharge home and people managing at home and not needing readmission. Or from our point of view, we've been able to link in with the ESD teams in our particular CHO, and that has facilitated then earlier discharge from our unit. And I suppose the caveat then is that you can increase your throughput or increase the number of patients who have an opportunity to come into you. And so I think as a model, if we were to mirror that, we've shown that that kind of system works and is very effective.
And that percentage that you just mentioned there, Dr. O'Connell, of 50% of patients
huge.
Are essentially blocking a bed, and to use that very much used term, because they don't have access to services in the community. So that means that effectively they're occupying a bed that you could use for another patient with a more acute rehabilitation need.
Yeah, I'm not a big fan of, as we use those words, bed blockers. Sure, we're not, because people obviously have needs, but there are certainly people who could progress to just having their needs met by a community team if there was one available. And as I say, the caveat then is that you can bring more people through your unit, and increase the number of people who are seen. So yeah, it is quite staggering. Yeah, that was our snapshot in time, and then the fact that we felt it would shorten length of stay from anywhere from 2 to 4 weeks. So, that adds up over a kind of a calendar year.
Certainly. And I suppose, the things that you're talking about are so much of the debates around our health service and so much of the mantra is around community. And this is along with, and you've given a very good example, a very good parallel with the early supported discharge teams for strokes. This is really Sorcha Care in operation, having this type of care in the community. Just before I move on to our next speaker, Dr. O'Connell, is there anything final you want to say around particularly, having a team in an area like CHO 8 that has a lot of rural counties? It's quite a distance away from the main neurology centres and rehabilitation centres in the country. Is there anything just you want to comment on, particularly in CHO 8 in that respect?
Well, I suppose that often providing this kind of service in those communities can be really challenging, and don't underestimate the kind of level of advocacy that needs to be done to advocate for them. I think people forget, how we can implement change by constantly drawing attention to, areas that have gaps in service. And I think that, there is a sort of a model for community rehabilitation teams that might need to be thought about, in terms of our goal is always to bring it as close to home as possible. That's obviously works better for people who can't access services, can't travel. And I think a lot of those issues come up with people with chronic neurological conditions, so while they might get offered community programs, they can't travel to them. And I suppose one of the hopes is with a dedicated community-based team that they can come to the patient. And so I guess maybe in a big community, a rural community, that's something that we need to bear in mind. Yeah.
So, and both of our lived experience representatives this afternoon are going to speak to that, of having to travel long distances to access neurorehabilitation that could be potentially made. And I know what you're saying is it's balancing, making sure that people have access to the specialist centres, but also if that neurorehabilitation can be provided closer to home, if people can be maintained and their functioning can be maintained closer to home, that's certainly a service that is needed. I might move on, Dr. O'Connell, if that's okay. Thank you so much for taking time from your clinic. We really appreciate it this afternoon, coming and just giving an insight from the front line as a clinician of the difference having a community neurorehabilitation team could make. Thank you very much.
No problem. Thank you.
Thank you. Rosie, I might move on to yourself. And just, picking up there on Dr. O'Connell's point of, realising that there are a lot of rural counties in CHO 8 and the challenge that presents for you as a person living in in Offaly and trying to access neurorehabilitation services. So I'll hand over to you.
So my name is Rosie Mangan. I'm a brain injury survivor. Let me just tell you a little bit about my brain injury. So I had it just over 3 years ago, a traumatic brain injury that resulted in a 6-week coma. And my recovery is ongoing because it's a marathon, not a sprint. And that's why we need a big focus on community neurorehab teams. Additionally to that, the first 3 to 5 years are critically important for brain injury survivors for functional neuroplasticity, where the brain learns to move functions from the damaged part of the brain to the undamaged area. Now, my brain injury, an MRI revealed quite extensive brain hemorrhage, but also a diffuse axonal injury. So the brain's long connecting nerve tissues throughout my brain were all severed. And this result, when I woke up from my coma, it resulted in quite significant physical and cognitive impairments, causing quite significant fatigue and chronic persistent pain. Originally, I was dependent on a tracheostomy to breathe. Then I had to learn to breathe independently, I had to learn to speak again, I had to learn to eat and drink again, I had to learn to converse. And I'm still learning how to use the left side of my body because it was completely unfunctional for a long time. So my accident happened when I was away on a research trip in Brazil, because before my accident, I was an academic researcher. I got repatriated back to Ireland. And when I was in hospital up in Dublin, I was waiting to become medically stable so I could get to the NRH. Unfortunately, this happened in December 2019. COVID kicked off when I was on the waiting list for the NRH. And my mum got a call to say, oh, we found a facility for your daughter. Now, my mum trained in the Mater Hospital as a nurse. She goes, I know the name of that facility. I don't think that's a rehabilitation facility. And sure enough, our suspicions were correct. It was a nursing home. An entirely unacceptable, inappropriate place to send a 35-year-old woman. I think what's important to note here is, in our very own CHO, there are 169 people living under the age of 65 in nursing homes, and the vast majority of them are people that are living with neurological conditions. And they're being denied the right to rehab, to rebuild their life, and they're faced with a lifetime of unimaginable loneliness, which is, in my eyes, completely unacceptable. Now, I got very lucky. I went to the now disbanded Neurological Rehabilitation Geriatric Stroke Unit. So I did get a taste of what it's like to be in a nursing home. But while I was there, I got rehabilitation. I'm very grateful for that. After 7 months of no visitation rules during COVID, I wasn't prepared for I was very excited to come home, but what I wasn't prepared for was a renewed trauma of limited rehabilitation in my community. Now, I did get referred to Acquired Brain Injury Ireland for occupational therapy, and that was to help me learn to adapt to my impairments, and also for cognitive rehabilitation. I also got referred to them for psychology, to deal with the huge adjustments in the life changes in the aftermath of my accident. But then I also got referred to the HSE primary care for physiotherapy and speech and language therapy. And I'm sure you're all very aware of the national understaffing and resourcing in HSE primary care. And I mean, I felt that I couldn't even maintain the functional gains I'd made in hospital with the physiotherapy I had, because my muscles got stiffer and weaker. The amount of physiotherapy started out getting 2 days a week, and that just got reduced to basically nothing. I lost further function in my limbs. I'm in so much pain at the moment. It's not a way to live. And then in regards to speech and language, and then I had to find out about other physiotherapy I could access. And now I'm traveling up and down to Dublin 3 times a week. That has a big impact on my fatigue because the service is not available in my own community. Also cost me money to travel up and down. So I haven't returned to driving since my accident. So I have to pay somebody to do that for me, and my family aren't available. And it's tiring to have to drive up and down to Dublin that often. But if I don't do that, my muscles are just going to be so weak and so painful. Then aside from physiotherapy, one thing that was very important for my recovery was speech and language therapy. Because at the time after my accident, I couldn't really breathe very well. There's no way I'd be able to give you this background on my recovery because I'd be completely out of breath. I wouldn't be able to emphasize what I wanted to say. And the understaffing and resources in speech and language in my primary care, I just didn't have any service, so I had to find my own vocal coach to help me. again, because those services are not available in my area. And that's another cost, another time. I just feel so forgotten about. I mean, and I would say that my experiences have encouraged me to become a committed advocate. And I linked in with Acquire Brain Injury Ireland on their Right to Rehab project. And that was funded by the Irish Equality Commission. And what we did is we wanted to find out the difficulty brain injury survivors had accessing the services they needed for their recovery. And we discovered about CHO 8, 50% of brain injury survivors can't access the services that they consider important or very important for their recovery because they're simply unavailable in their area or the amount of service is completely unsatisfactory. And we really need a community rehab team in CHO 8 to right that wrong. You know, in my experience, when services are unavailable or limited, I suffer further complications of my neurological condition. But a community rehab team would allow me to live within distance of services of people with the expertise to keep my mind and my body healthy. They would keep me out of hospital. They would allow me to maintain the functional gains I've made. Not just that, but build on these and ultimately allow me to live my life without the worry that my neuro condition is a barrier to my life's progression. Like with the rehabilitation I have received, I've been able to flourish. One thing I would say with Acquire Brain Injury Ireland and the OT, I honestly thought my life as an academic researcher was over. But then I did this Step Ahead vocational program. I'm hoping that I can go back to college in September. I never thought that would be possible. The other thing I never thought I would want to do again is get into a car. My psychologist with Acquire Brain Injury Ireland helped me do that. And now I'm able to attend outpatient appointments without having panic attacks. But more, which I never saw happening, I'm actually about to do an assessment with the IWA to actually return to driving myself. And I hope those two examples give you a real feel of when services are available, they can change our life. And we can live our life to its full potential. You know, 19,000 people in Ireland acquire a brain injury annually. And that's only 1/4 of the people that live with neurological conditions. But in fact, the World Health Organization says 1 in 3 people will have a neurological condition in their lifetime. It's the leading cause of disability and it's the second leading cause of death. But that doesn't need to be the case. If every CHO, but our CHO in particular, had a community neurorehab team, we could live our life to its full potential. And we really need you, our elected representatives, to influence the commitment for funding for a team in CHO 8. Thank you very much.
Thank you so much, Rosie. And just to pick up on a point that you made earlier, you had family members to bring you to Dublin 3 times a week. And as you say, when you didn't have family members available, you had to pay for transport, for someone to drive you, for a service that should have been available locally to you in CHO 8. And I know you've said to me in the past that you felt lucky because you had that support, and you felt for the people that couldn't travel to Dublin for whatever reason, didn't have transport, couldn't do that, and they're essentially denied that chance of recovery that you had.
And that's something with the Right Rehab survey that we did. We interviewed 70 people across Ireland, and I'd say they said the most negative impact on their recovery was lack of transport and money, because they can't access private services when the public services aren't available, or when they do have outpatient appointments, say in the NRH or in whatever place, they just can't get to them.
And it's an extremely long way from Dangan, County Offaly to the National Rehabilitation Hospital for people having to travel that distance for what should be available in their own counties. Even
the physiotherapy I go to a couple of times a week, like I spend probably 3.5 to 4 hours getting to and from there. 2 hours of physio, and it stops me living my life. I want to get back to work, but I just don't have the time to do that at the moment. But if I don't do the physio, I'm in so much pain. So it's just so difficult to get it right at the moment. But if it was close to me where I need it, it would make so much a difference to my life.
And I think that's the critical message you're saying today. This should be available to people in CHO 8, and calling on the elected representatives on this call to make that happen, to make that available in CHO 8 the way it is in other CHOs around the country. Thank you, Rosie, so much.
And we're a very big CHO, and we need these community neurorehab teams.
Absolutely. And these teams, they're government policy. They were promised in the National Neurorehabilitation Strategy.
That was a long time ago as well. We're waiting a long time.
Exactly. And the one thing people recovering with neurological conditions don't have is time. As you say, you have a life to be getting on with, and you need access to the neurorehabilitation you need. I'm going to go to our final speaker, Sorcha Boyle, who lives with multiple sclerosis. I'll bring you in there, Sorcha.
Hi, thanks for that, Rosie. That was fantastic. Very, very well said. Absolutely brilliant. So, my story is a bit different to Rosie's. I'm living with multiple sclerosis. I've had MS since 2014. A year after my diagnosis, I became critically unwell with my MS and was blue lighted to Beaumont Hospital, where I was spent 10 weeks in Beaumont Hospital, and I was so acutely unwell. I was in a high dependency wing of the neurology ward. I couldn't swallow. I was what they call full clears. I couldn't bathroom. I couldn't do anything. I literally couldn't do anything because the MS had gone so haywire. I spent 10 weeks in Beaumont Hospital, and I actually would say that I'm lucky. I'm lucky that I went to Beaumont and that I didn't go to my local hospital, and that Beaumont and my fantastic neurologist in Beaumont linked in with the NRH. So I went as an inpatient to the NRH in early 2016. So in total, from one relapse, I spent 18 weeks in hospital, 10 weeks in Beaumont, but then I had to wait. Even back then, there was a waiting list to get into the NRH. And once I was past the acutely unwell phase where I could manage a little bit at home, I couldn't go up and downstairs. I was still in a wheelchair. I had to sleep in a hospital bed in the downstairs room here. I'm a mum of she's a teenager now. At the time, she was 9. And also, I picking up on what Rosie said, I remember being in Beaumont and doctors telling me that I would have to consider going into a nursing home. And I was 34 and I had a 9-year-old daughter. And I just thought, what are they talking about? Like, I had had assessments to see if I had a brain tumor. I had to have biopsies of my brain, thankfully. And I'm very lucky that I only had MS, but I had what they call a tumefactive MS. So I went to the NRH, and like I said, I spent 8 weeks there, and I'm lucky that I got into the NRH. I'm lucky because if I hadn't gone to the NRH, I would be a full-time wheelchair user. There's no question of that. There's absolutely no question, because I had to learn how to walk again. So that was 2016. And as I was saying to Mags before, that is the last time I saw an OT in 2016. That was early 2016. So I haven't seen an OT in 7 years. And I have MS. MS is not going anywhere for me. Last year, I had to become an enforced health tourist because I needed to go for a treatment in the UK for my MS. I had a stem cell transplant in London. That stem cell transplant was a game changer in a lot of ways, and my disability has reduced somewhat in that I don't wear a leg brace anymore, and that I, generally speaking, don't use a walking stick unless I'm walking outside, whereas sometimes I would have been using a wheelchair. So I have, in a way, have to learn how to walk without these aids, without a brace on my leg, without walking sticks. That actually, and I would have atrophy in my legs, and my right hand side had completely stopped working. I need to see a physio to help me train my brain how to walk without these things. And I cannot see a physio. And if I need to see a physio, I am told that it's a 9-month waiting list for an outpatient appointment in the NRH. So, as Rosie was saying, like, disabled people live in persistent poverty. That's just a fact. None of us have any money. And the cost of fuel and the cost of tolls, and like I live, literally, if I throw a stone, County Monaghan is just there. If I throw a stone that way, County Meath is just, I live in the middle of nowhere. So if I need to get to the NRH, I have to drive myself to the NRH. I can't afford it. I can't afford the driving up and down for the. It's too exhausting. So I could drive there. It'll take a good hour and a half because it's right at the end of the M50 to have maybe half an hour physio to drive an hour and a half. It doesn't make any sense. If I need to see physio here in this CHO, the physio here is a generalist, and he would do stuff like respiratory physio or physio for the elderly. I don't need either of those. He doesn't necessarily have the neuro expertise. So if I need any sort of neurology-based physio, it's not available. And like the way it went for me is I had to get acutely unwell to the point where I was in a high dependency unit and I was there for 10 weeks before everything kicked into gear. And even then, that's years ago. That's 2015. So I can only shudder to think of how bad it is now. But if I needed to go to the NRH now for outpatient, I actually wouldn't do it, because it's the traveling up and down. It's too far. I don't know what the therapeutic benefit I feel would be outweighed by the fatigue and the exhaustion of just going up and down to it all the time. They don't have, like I say, I haven't seen an OT since I was in the NRH as an inpatient. And that OT was helping me, as I was there in the NRH under the brain injury program, because my MS was considered a brain injury because it was so severe. And they had to bring me to like shopping centres and give me a list of tasks, and I had to do them in a certain order to get my brain working again. And I think that if I hadn't, I feel very lucky, and it shouldn't come to this, but I feel lucky that I got to go to the NRH, because if I hadn't, I would still be in a wheelchair, and I probably would be in a nursing home, because there's no community neuro team for rehab. There is nobody. And I'm told there's not even the funding in place for it. So if I'm my own kind of stubborn pig ignorance and my determination to be a mum to my daughter that wasn't trying to mammy from a nursing home, it's bad enough trying to mammy from a hospital, but trying to do it from a nursing home when everyone around me is 30 or 40 years older than I am, I just thought, no, I can't do that. But it was very much like presented as even back then, that's the way it was going to go, because there was no team in place. And, the HSE are great in one way, but that they have this living well with chronic conditions, so they have like diabetes, asthma, COPD, neurological conditions are not listed on that. And they don't count them because they're too complex. So my MS is completely different to Rosie's brain injury, and someone's Parkinson's is different to somebody's Huntington's, and they're all so different. So that's why the speciality needs to be in place. There's no point in me going to see a physio who specialises in care for the elderly or chest physio or whatever they do. I need to see a dedicated neuro one. Last week, I had to badger my MS nurse for over a month because I had a problem with my hand. My hand is not opening fully and all that kind of stuff. And I had to badger her for over. So my hand has been giving me problems since the start of May. Today is 13th of June. And last week, I saw a physio in Beaumont. So I had to drive up to Beaumont just to go for a physio appointment. And I saw, very luckily, the physio who had looked after me when I was in for that time. It's the same physio. But she said to me, well, what can your community physio do? And I said, well, I can't get through to him. If I ring him, his mailbox is full and you can't leave a message, and that's it. And there's no actual way to link in with anybody. There's no way. If there was somebody who actually in local primary care, and I'm happy to travel to Navan, for example, because it's closer than going all the way to Dublin or all the way down to the NRH. I'm happy to do a bit of travelling if it meant that I had a community team that I could link in with periodically, because I know I had a stem cell transplant, but my MS is merely paused. It's not gone anywhere. It's just paused. That's all. And eventually it's going to rear its ugly head again. And I'm going to end up, and like you were saying about neurological patients, we are frequent flyers in hospital. And where I live, my local hospital is the hospital in Drogheda, and they don't have neurology as a service. And I've often had, in the past, a relapse or whatever has happened, I had to go to Drogheda Hospital and they don't know what to do with me. So they consult Beaumont, who say do X or Y or Z, and then the bed blocking again to keep you there until the visit neurologist comes. So I might be in there on a Wednesday and I have to stay in hospital till a Monday to see a neurologist. There's no need for that. There's no need for that, because I kind of would know, right, this relapse come to an end. Steroids have helped. I can go home now and be present for my daughter. Like my daughter, for example, is completely traumatized by my health. She's a complete hypochondriac. She can't stand me going to hospital for an appointment. She, and it's a knock-on effect. And if I could just have my community physio, community OT, community whatever, she doesn't have to know about it. But if I have to go to hospital, it becomes this big drama. It becomes this big thing in her life. she's going into leave cert in September. She doesn't have the headspace to be worrying about, oh, mommy can't walk again. And, you know, like it had to get to a point where I was being fed through a tube in the nose. I had nappies, I had catheters, I couldn't move before I got access to all of these things. But it should never come to that. It should never get to the point where somebody is in such a severe crisis with their health. And you know, the thing about MS is it's not fatal. Nobody really dies of MS. You might die of maybe secondary complications, but it's not the actual MS that's going to kill you, you know. So it's kind of like, it's MS. You have it forever. That's just the way it is. But I would like to live well with MS. And, you know, MS Ireland have good, like, chair yoga programs online and all that, which is all great, but it should be available via our CHO. You know, I shouldn't have to log in to do, you know, Move Smart with MS and all that kind of stuff. Like, you know, I personally try as much as I can to keep myself moving, you know, as much as I can. But at the same time, I need to learn how to walk again without a walking stick properly, without being afraid that I'm going to fall down. And my transplant was March of last year, and I've had no physio since. Absolutely none. The only physio I had.
That's kind of the higher end of healthcare that you've had, Sorcha. You had the most expensive healthcare, but not the preventive healthcare that you could have close to home in terms of physiotherapy. And I have to say, these are for any of the elected representatives on the call, these are shocking stories from people in CHO 8 traveling to Dublin 3 times a week. On Rosie's case, and in your own case, Sorcha, being told that you can drive from the Louth border to the National Rehabilitation Hospital for physiotherapy, or do without, or essentially do without.
I've been basically managing myself, but I'm probably not doing it the way I'm supposed to be doing it. I've had to just find a way to just get on with things, but like, I have trouble with my hand, and very luckily for me, I'm left-handed, and this is my right hand that doesn't work. But you know, like, I shouldn't have to go, well, am I lucky it's not this or that? But I'm not lucky. I have MS and I have it forever. And it would just be easier to manage it if there was a community team of people who had the expertise, because a lot of the people in primary care are generalists and they're not specialists. And I think that's where the gap is, that there isn't specialist stuff. It's all very generalized, and it's all very looking at the community as well, which is perfectly fine. But at the same time, neurological patients have very specific needs that maybe other people don't. And those are gone.
And I think what disappoints people so much around the community neurorehabilitation teams is this is not a notional or theoretical team. These teams are up and running in Donegal and Limerick. They have been for years, for over a decade. But they're not available to people in other parts of the country, despite the recommendation. And this is just wrong. And as they we are calling with the Patients Deserve Better campaign, we are calling on the local representatives for CHO 8 to campaign for that government policy to have one team in each of the 9 CHO areas around the country. On the 27th of June, the Neurological Alliance will be launching our pre-budget submission, which will call for those teams to be, all 9 teams around the country, to be fully staffed to meet the local need. I want to thank Rosie and Sorcha and Dr. O'Connell for their powerful testimonies this afternoon, pointing out just what a difference a community neurorehabilitation team would make to people's lives. This is something that should be available in CHO 8, that people have a right to in CHO 8, along with other parts of the country. And it is having a devastating impact on people's lives not having that team in place. So thank you all very much to our speakers this afternoon, and we send a powerful message to the elected representatives to join and support our Patients Deserve Better campaign for a community neurorehabilitation team in CHO 8. Thank you all very much.